Hi, this is Linda Pouliot and from Nursing 210 at Liberty University. This is my second shot at my final interview assessment because my computer didn't have storage. So let's hope for the best. And this is Rita, and she's been amazing at helping me out tonight. So we're going to get started. We're going to do our head-to-toe assessment. So I would normally come in and do wash my hands, do vital signs on the patient, ask about her any pain or any issues she may have. Make sure she has privacy, shut the door, and then we would get started. So Rita is here for her head-to-toe assessment, and I'm going to just start by assessing her skin at first. Her skin is light to tan in pigmentation. It's smooth. She has some small macules throughout her arms and on her face. It's warm to touch. I'm going to assess her lower extremities. Oh, thank you, Rita. Her lower extremities, the skin is the same color as the rest of the body, and it is warm to touch as well. Toes are a little bit cooler. Okay, she's not sweaty. It's smooth, and I don't notice any major lesions or bumps or anything like that. I'm going to assess her skin turgor. The skin turgor is an indication of good hydration when it goes back down. Then I am going to assess her hands and her nail beds. Her nail beds are adhered nicely to her fingers. Her nails are well manicured. They're round. There is no fungus, and they're not coarse at all. And I'm going to do the capillary refills, which is less than 3 seconds. I'll be doing the capillary refills on the toes as well. The toes are cooler to touch, like I said. Capillary refills are less than 3 seconds on toes. So now I'm going to I'm going to have Rita do your fingernails, nails to nails, okay? And then nails. So I'm looking for any clubbing. She can put her nails together, and it's about 160 degrees, which is normal. Okay? Okay, so now we're just gonna start at the head. And her head is normocephalic, it's midline, there's no abnormal tics that I notice. It's proportionate to her body. I am going to move your scalp. Any tenderness, her scalp moves freely, and there's no crepitus noted. Her hair is very soft and brown. There's no split ends. Her hair distribution is normal for female hair distribution. She has no balding spots, no alopecia, no signs of infestation. I'm also assessing her scalp, and I'm looking, sorry, did I spit in your face? I am assessing her scalp, and I'm looking for any lesions or bumps, and I do not see anything. And her head and scalp is smooth. Her scalp is not dry, and there's no flaking noted. Okay. So now I'm going to assess her lymph nodes. Actually, first I'm going to do her sinuses. Okay. Any pain?
Nope.
Okay. No tenderness?
Nope.
Okay. So now I will assess her lymph nodes. We're going to do the preauricular, postauricular, occipital, the carotid, the deep cervical chain, anterior cervical chain, posterior cervical chain, and then the supraclavicular chain. Right? Yeah. Okay. I always mispronounce that. Okay. Good. All right, good. So now I palpated your lymph nodes, and I didn't feel any lumps. If I did feel any lumps, I would notice if they're hard or movable or anything like that. I did not notice. So I am going to listen to her carotids for a brewery. I'm going to use the bell of my stethoscope. No bruise found. And prior to that, I should have palpated each carotid. And you want to do one carotid on each side. You cannot do them both together. So now I'm going to step on the back of her bed. That's okay, Rita. I'm going to palpate her thyroid. I did not notice I cannot see her thyroid at all. Okay. And while I'm back here, I'm going to do the spinous process. Any pain, tenderness down here, down your neck? Okay, perfect. So Rita, I'm going to have you turn, if you can move your head to the left. And this is where I'm going to be palpating the right thyroid as her head is turned toward the left. Okay, and then I'm going to have you turn towards the right, and I'm going to be palpating the left side for her thyroid. And I do not feel anything, which is normal. Okay. All right, so now we're going to start with her face and do her eyes and her eyebrows. So her eyebrows are normal. They are proportionate, symmetrical, proportionate hair distribution, and they're in a good shape. Her eyelashes are dark in color and they're pointed outward. No signs of alopecia on her eyebrows or eyelashes. I'm going to palpate the lacrimal ducts. Okay. Any pain? Nope. Okay. Good. All right. So that was palpating the lacrimal ducts and sac. And she's blinking normally. I don't notice any lid lag with her eyes. And now I'm going to look in her eyes. Sorry, get my pencil, my light. So I'm just going to shine the light real quick. Okay, good. Her pupils are round, reactive to light. Her irises are round and brown in color. Her sclera is white. Her conjunctivi is pink and moist. So if I were in an office, I would do what we call the red reflex. So I would take the scope and kind of look and make sure I see a red light. So I have positive red reflex. I'm also going to do something called checking for corneal clarity, which I'm going to just move the light, sorry if this bothers you, on each side. And that is clear. Perfect. And now we're going to do the 6 stages of gaze. So what I'm going to have you do is follow my light, okay? Mm-hmm. You're going to keep your eyes focused on this as I move it. Okay? Keep your head still. I'm going to look at your pupils again. Okay. They're round and reactive to light. We're going to do the cover and uncover test next. So I need you to cover your eye, one of your eyes. I want you to look towards your right. Okay, and then uncover this eye. And both her eyes are looking to the right, and that was positive. So we would do that bilaterally with both eyes. Now we're going to do another eye exam before I look into your eyes, okay? So we're gonna do a peripheral vision. So when you see, this is the bunny. When you see the bunny, you need to let me know. So I need you to cover one of your eyes, whichever one you want, okay? And I'm gonna cover my eyes, and you tell me when you see the bunny.
Okay. 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 Okay.
Okay. So keep that eye covered.
Oh.
Yep. Okay.
Okay. Okay. Okay. Okay.
Okay. Very good. So now I'm going to look into your eyes. I'm not going to flash my light into her eyes because that will bother her because it's not the real light. So I'm going to be good. And I would look bilaterally in both eyes. And sorry, my breath smells. I am looking for the optic disc and the optic disc and the fundus. The fundus would be creamy yellow in color. I'm looking at all of her vessels and everything looked normal. I didn't see any type of abnormalities behind the eye. Okay. So that was cranial nerve number 2, which is optic nerve. Okay. Now we're going to move on to cranial nerve 7, which is facial gymnastics. So we're going to do some gymnastics with me. So I need you to close your eyes, open your eyes, raise your eyebrows, below your eyebrows. Okay. Smile without showing your teeth. Smile with showing your teeth. Purse your lips. Puff your cheeks. And put your tongue in each cheek. Oh, and you can stick your tongue out too. That's okay. Okay, excellent. So now I'm going to do cranial nerve 5, which is a trigeminal cranial nerve, and that's going to test for sensation on your face, okay? All right, so this is going to be sharp, and this is going to be soft. Can you tell the difference, okay? Okay.
Sharp. Sharp, soft, soft, soft.
Perfect. Okay. So next I am going to do the nose. The nose is symmetric and it's proportioned to her face. And I'm going to go look inside your nose. Where did my light go? I put my light. So if you could, sorry, if you could look up for me, I'm looking inside her nose, and she has normal hair distribution in her nose. Her septum is midline and no deviation noted. There's no drainage. There's no redness or swelling inside the nasal passages. So now we're going to do a test to test the patency, so I need you to, okay, and close. Excellent. And now we're going to do smell test. And this is cranial nerve 1, which is, this is cranial nerve 1, which is olfactory. So I'm going to have you close your eyes, and you're going to take a little sniff. Tell me what it is.
Oh, that's lavender.
Okay, good. Next.
Orange.
Orange.
Oh, it smells good.
Yeah. Excellent. Okay. So we did the nose, and now we're going to do the mouth. So I'm going to assess her lips. Let me see your lips. Her lips are smooth. They're not chapped. They're pink in pigmentation. Can you smile for me? Good. Okay, and now I would have her open her mouth, and if I had gloves on, I would feel the inside of her mucosa. I notice that it's nice and moist. I don't see any lesions or bumps. Can you stick your tongue out for me? Okay, good. I don't see her tonsils have been removed. The vulva is hanging down nicely, and it's midline. Her teeth are well groomed and well brushed. Her gums are pink and moist. Yeah. She flosses very good. I don't see any current teeth decay. There's some old fillings in there. All right, I need you to open your mouth. I'm going to look at all the frenulums, the front one, the tongue, and they're all connected. Good. Any pains in your mouth at all? Okay. I need you to stick out your tongue and move it side to side for me. Excellent. I'm just adding my ear thing here for that. And we did just do cranial nerves number 9 and 12, which are hypoglossal. So now I'm going to look in her ears. Left. I'll do your left. First, I'm going to assess the ears. Her ears are well proportioned to her body. They line up appropriately. The helix recoils well. Any pain or tenderness in your ears?
Nope.
Okay. Any hearing problems at all? Okay. So we would do a hearing test. I'm going to do the whisper test, okay? I'm going to whisper whisper something in your ear, and I want you to tell me what I say.
Okay. This nursing class is almost done.
Yes, correct.
That's good.
All right, so I'm going to get my tuning fork, and we're going to assess the cranial nerve for hearing, okay? So what I'm going to do is this test is I'm going to do a vibration. I'm going to put it on the top of your head, and you're going to tell me if you hear it in both ears or just one, okay? If I can get it. Do you hear it in both or one?
I hear it in both.
Okay. Tell me when it stops.
It stopped.
Okay. And then tell me, I'm going to put it behind your ear, and you tell me when you hear it stop.
Stop.
Good. And I would do that bilaterally, and these are the Webner test and the Rhines test. Here. So now I'm going to look inside the ear. I'm going to look inside the left ear at this point, but we would do the ears bilaterally. I'm looking in, sorry, I'm talking so loud. I'm looking inside the ear. There is minimal wax accumulation. I can see the inside of the ears, the outside, and the tympani is gray in color of the ear canal. Okay. And the cone of light on the, did I say left ear? I was assessing her right ear. So the cone of light on the right side would be at 5 o'clock. The cone of light on the left side would be at 7 o'clock. There's no redness, bulging, or any discharge. Okay. All right, and if you could look straight again.
Oh,
that's okay. So now we're going to do the neck. Her neck is symmetrical. It is erect. Go ahead and swallow. Good. And her trachea stays midline as she swallows. And I don't notice any bumps or lesions. And we already did the palpitations for the thyroid and the lymph nodes in the neck. So now I'm going to move down to the thoracic and cardiac portion of this exam. So I'm going to kind of just palpate it first to see if I feel any bruise or any murmurs that I can palpate, which I don't. Have you had any breathing problems at all?
No.
Okay. So I'm going to have you turn. Can you turn?
I'll turn this way.
Yeah. Okay. So what I'm going to do now is palpate, and we're going to do tactile firmitis, which is I am going to have her say 99 as I am palpating her back with this part of my hand, and she's going to say 99. So when you hear me, when you feel me touch, say 99.
Okay. 99,
okay?
99, 99, 99, 99, 99.
Okay, good. And I felt every time she said the 99, I did feel the vibration here. Okay, so now I'm just going to listen to her lungs bilaterally. If you can just breathe normally. And now I'm going to feel for the 10th intercostal space. And I need you to take a nice deep breath. Good. And this is equal bilaterally when she takes a deep breath. So now I'm going to percuss her lungs. And now what I would do is while I'm percussing, I'm going to have her take a nice deep breath. Okay, hold it in. Okay, and then I would mark that spot. And then exhale, let it out. I would mark that spot and I would measure it to make sure that it is within normal limits. just checking my computer has been giving me problems. And make sure that the measurement is within normal limits, which is 3 to 6 centimeters. Okay?
Okay.
So now I'm going to do the cardiac portion
Okay.
of your exam. And I already listened to the thyroid and the carotid, but I will do that again because I want to make sure. Good. And then I'm going to listen to the fourth intercostal space, which is the PMI. And we do the second intercostal space as well, the right and the left. And then the herbs point. Good. And all I hear is S1 and S2 sounds. I do not hear any abnormal S3 or S4 sounds in our heart. And you don't have any cardiac problems, correct? Okay, excellent. So now what I am going to have you do is lay down so I can do, we're going to do your abdominal assessment. So with the abdominal assessment, I'm always going to look first, and I look and make sure that I don't see any peristalsis. I see normal respirations and normal skin color. I don't see any significant lumps or bumps. Are you falling asleep on me?
Yeah.
And then with the abdomen, before I would percuss or palpate, you're going to actually auscultate. You're going to auscultate in all 4 quadrants, or I'm going to, and I'm listening for vowel sounds, which she has plenty. You would listen for at least 5 minutes if you didn't hear any. And as I'm listening, I'm also looking at her umbilicus, and there is negative colon sign. Okay. Have you had any abdominal problems? Okay. So then I'm just going to palpate lightly, or a little bit firm in each quadrant of the abdomen. No tenderness at all. Okay. And I'm actually going to auscultate, which I should have done before I palpated, over all the organs. So I'm going to auscultate over the liver, the spleen, the aortic. I'll palpate the auscultate the iliacs, sorry. And I would also palpate and listen to the femorals, but we're going to defer those for Rita's sake today. So then I would palpate all 4 quadrants, okay? And then I'm going to palpate the liver. Palpate the liver here. And I'm palpating to see if I have any rigidity or anything like that. Take a nice deep breath. Okay, good. And I don't feel any of that. And then I'm going to percuss the liver. And what I'm going to do here to check to see if it's enlarged, I'm going to percuss the liver. And from here, I'm going to percuss from tympani to dull. When I hear that, I will mark it. And then I'm going to start percussing up here, and as I percuss down, I am going from resident to dull, and then I would mark that. I would measure it with my measuring tape, and it's within normal limits because it's 3 centimeters. Normal is 4 to 8. Also, I am assessing her skin color on her abdomen as well. Okay, so now I'm going to percuss the spleen, and this is tympani. If I heard any dullness, that would be an indication that it's enlarged, and you would be able to palpate it if it's enlarged. It is not enlarged, so I am not able to palpate that. I am going to palpate the kidneys on each side. Any pain or discomfort? No. And then I'm going to percuss the bladder, and I expect to hear a dull sound if the bladder is full. Okay. So while you're laying down, I'm going to start with some leg movements. We're going to do flexion and extension of the hip, okay? So I need you to raise your, straight up. Raise your legs straight up and straight down. Flexion and extension. Now against my resistance, straight up and straight down. Perfect. We're going to do adduction and abduction. So adduction, abduction, crossover. Good. Excellent. And now we're going to do flexion and extension of the knee. So I need you to just bend your knee. We don't do hyperextension of the knee. Flexion and extension, and then against my resistance. Go ahead. Yep. And then against. Good. And down. So now we're going to do internal and external rotation. So I'm going to have you sit like a man while you're laying down. There you go. And then knee to knee. Internal rotation. Knee to knee. Okay. Perfect. Good, good, good. Okay, and now you can just straighten that out. So now we're going to move on to the lower extremities here. We're going to do flexion and extension of the foot. So nose to toes, toes out. And again, you do this against my resistance both times. Good. Internal and external rotation. Internal and external. Good. Now, rotation of the ankle. So I just want you to move your ankle in a circle. Perfect. Excellent. We would do that bilaterally as well with both extremities. Okay. Okay. I am going to have you sit up if you could. So now, let me fix your hair. All right, so now we're going to do some musculoskeletal stuff. Actually, before I get you up, I'm going to do reflexes while you're sitting, okay? I've got my hammer here. Let's do this one. So we're going to do the tricuspid. Okay. Tricuspid. Good. Radial. Good. I'm going to do the knee. Oh, this one she had a knee replacement, so I'm going to do this side. Good. +2 reflexes. I am going to do the ankles as well. You can see. My hand is blocking it here. Good. Excellent. So next we're going to do the joint test too. I'm going to palpate all the joints. No lumps, bruises, or anything. She's able to move her joints freely. So I would do this. I'm just going to do a couple of joints, but we would obviously do this bilaterally on all joints. So what I'm going to do is when I hit this, I'm going to put it in a joint and you tell me when it stops. Okay? Stop. I'm going to have you shrug your shoulders. That's cranial nerve 11 against my resistance. Okay, perfect. So while you're sitting too, we'll do the elbows, extension and flexation of the elbows. Okay. So out and in. Perfect. And then we're going to do it against my resistance. So down, up. Perfect. And now we're going to do adduction and abduction of the arms. Out and adduction in, okay, and then against my resistance, both ways, okay, and then arms above your head, good, arms behind your back like you're getting arrested, good, this is hyperextension, excellent, and now we're going to do your hands, make sure you can see, we're going to do flexion and extension and hyperextension of our hands, so all the way back, down, perfect. And then we're going to do abduction and adduction of the fingers, abduction, nope, keep your wrist still, abduction, adduction. So apart and together, perfect. Now I want you to put your fingers, squeeze mine in there, perfect. Now keep them like this, shut. And now I want you to grab, I want you to test your strength, yep, perfect. There's equal strength bilaterally. So now I'm going to use your fingers, and what I'm going to do is I'm going to have you close your eyes while I do this. This is going to be neutral, this is going to be up, and this is going to be down.
Okay.
I'm going to do this, and I want you to tell me with your eyes closed what position I am doing.
Okay. Up. Straight or down.
Neutral.
Yeah.
And down. Okay, perfect. And I would do this with bilaterally, and I would also do it with toes as well. Okay. Another test we're going to do is the point and tell sensation test. So I'm going to point, like do this on your wrist, and you're going to tell me where I'm doing it and point to it at the same time.
Okay.
Okay?
It's right here.
Okay. In your elbow?
In my elbow, I'm sorry.
Okay. That's okay.
My thigh.
On top.
On top, and
Okay.
it's right there.
Perfect. Perfect. Oh my God. So my computer just went black for a second. So let me do that over because I'm not sure what just happened. This is freaking me out. All right, so I'm going to do the point test. Close your eyes. Point to where I'm doing it and
Right
tell me.
here in my elbow.
Perfect.
My thigh.
Perfect. Okay. So now keep your eyes closed, and I'm going to do the 2-point test. And what I'm going to do is, you feel those 2 points and
Shades.
1 point. Yeah, I'm going to do that. You tell me when you feel 2 points and 1 point. Okay.
One. Oh, that's 2 points. 2 points. 1 point.
Perfect. Okay. You can open your eyes. Okay. I'm just making sure we're still going. Okay. Timer's still going. So I did all her reflexes. We did her arms. So now I'm going to have her stand up. Okay. And we're going to do, you can stand this way. We're going to spread our arms out, and we're going to do with your eyes open, finger to nose.
Okay.
Both sides, with your eyes open.
Oh, I'm sorry.
Yep, that's okay. And now do it with your eyes closed. Perfect. Put your arms down. Keep your eyes closed. I'm going to push you. Negative Romberg's test. She's not falling over. Excellent. So you can open your eyes. While you're standing, we're going to do hyperextension of the hip because we couldn't do that when you were laying down. So if you could almost just do a lunge, like put your leg back. Perfect. Okay. Excellent. And now Rita is not able to do this portion because of her back surgery that she had. But this is, we're going to do standing our body still, and we're just going to move our trunk side to side, and rotation. Okay, perfect. We're going to do the same with the neck. We're going to do side to side, okay, and then rotation all the way around, and flexion and extension, hyperextension. And you're going to do those against my resistance too. Forward and back. Okay, excellent. You can have a seat. So I am going to have you close your eyes. I'm going to give you an object, and I want you to tell me what it is. This is called stragnosis, okay?
Okay.
So hold that, feel it with your fingers.
I think it could be a nickel.
Perfect. The next test I'm going to do is the graphesthesia. I'm going to write a number in your hand, and you tell me which number it is.
5.
Sure. Good job. Okay. We have done our head-to-toe assessment, and we've gone over all the cranial nerves, and Rita is in good health.
Thank you.
Thank you very much. Hopefully that